I'd like to spend a minute or so talking about how important it is for us to make sure that when we bring sterile objects into a room, that they stay sterile. What I'm trying to get here is that you need to make sure that you're wearing gloves at the proper time. For example, if there's a bag of instruments that we're going to open up, it would be improper for us to open them up, especially in a hurry if the doctor wants a mirror, to grab the mirror and hand to the doctor like this. I know that sounds funny, but I see it all the time with all sorts of instruments. Recently, somebody gave me a forceps, reached into the nice clean bag, grabbed it with their bare hands and handed it to me right on the beaks, the area that's going into the patient's mouth next. First of all, obviously, if you're going to touch anything, even with a gloved or ungloved hand, grab it on the handle after you've taken it out. Remember, these things are going to the patient's mouth. When you open up sterile instruments, even if you're in a hurry and even if the doctor's really getting irritated because he doesn't have what he wants right now, you still need to remember it's important that what the doctor receives needs to be sterile. When you get the sterilization pouch, simply open it up like this, drop the instruments on the table. Now you haven't touched anything and they're sterile for the doctor to use. Sometimes I'll also see when we have instruments or burrs or other things in a drawer, sometimes while the patient is there or a relative or a mother is in the room, I'll see somebody walk in and with an ungloved hand, open the drawer and reach in and grab something and hand it to the doctor with their bare hands. Do you know how terrible this looks to a patient? Please make sure that if you're going to grab something out of a drawer, that when you pull the drawer open, take a sterile tweezers and reach in and get what you need. We don't need to be putting our gloved hands in there. Even if you weren't the assistant with the bloody glove and know you'd never do that, if you're a second assistant coming in, it's just as important for you to make sure we follow these protocols. Reach in and grab things with sterile tweezers. Don't use your bare hands or even a gloved hand to reach inside the box. There's just right ways to look like we're doing a good job keeping things clean. Thanks. I'd like to take a few minutes to talk about the importance of cleaning our instruments correctly. Certainly when you use dental instruments, over time things get stained and there's lots of composite and bonding agent and there's impression materials and there's paper that we use for articulating paper, and all these things with time will tarnish an instrument. That's not what I'm talking about. I'm talking about things that unnecessarily get left on the instruments which should have been cleaned off in the sterilization process. For example, the greatest offender and my #1 pet peeve as a dentist is when I get an instrument and I'm ready to use it and there are still pieces of composite left on my composite instrument. Sure, it's been through the sterilizer, so yeah, okay, it's sterile. But when you have this much composite left on an instrument from before, it's very difficult to use the instrument. In fact, the instrument is useless for the dentist unless it's been cleaned off. It's important to make sure that all of these things are cleaned and scraped off long before the dentist ever sees it. The assistant that hands this to the dentist is the one that's responsible to make sure it's cleaned off long before he ever gets it. She may want to blame somebody else for not having cleaned it off earlier, and she may be right that it didn't get done at the right time, but the assistant that hands it to the dentist is the one who's ultimately responsible. These are not difficult to clean off. All it takes is some foresight and some recognition of times when it actually gets stuck on the instrument. For example, after the dentist uses the instrument in the mouth and there's still composite on it, you'll want to make sure before you ever take the tray out of the operatory that you've cleaned off all of these things. Wiped them off, scraped them off, whatever you need to do. See, this stuff scrapes off really easily when you take another instrument. It just takes a couple seconds to clean it to where it's workable for the doctor. But if you let it go, it just piles up and it's going to be on for the next time. So again, the first time you clean it is when you're leaving the operatory. The second place to check for these things is before this goes in the ultrasonic. All sterilization assistants should be checking beforehand that there's not one piece of composite on any one of the instruments in the tray. Sometimes there will be big chunks of impression material left on here from a crown and bridge, like right You can't see this one very well. There's a small piece of impression right on this tooth right here, on this mirror. Why was that left on? Why wasn't it caught early on in sterilization? Before these things go into the ultrasonic, all instruments should be cleaned off so there's no pieces of material on them at all. And then finally, when you're setting up for fillings and you put this tray out, before the dentist gets in there, long before he or she arrives, pull out the instruments, look at the composite, and make sure there is nothing on there. Get it scraped off. I guarantee you, the doctor will have to stop their process, and production will come to a standstill while someone takes time to clean off the instrument right when the doctor needs it. Biggest pet peeve, biggest way to be on the bad side, leave impression or leave composite material on the instruments. Please clean them off.